as the number of COVID-19 infections in India has neared 60,000 now, the centre has today revised its policy on the discharge of COVID patients and most crucially said that only severe cases will now be tested, that too only once before being discharged. So that's an important change in the policy that the government has had so far with the severe cases of coronavirus. They'll be tested only once before being discharged. Let's go across to Arvind for more details on this. And Arvind, till now, patients would be discharged only if 2 tests came back negative. Also, mild cases will not need to be tested before being discharged.
Yeah, Gargi, as the number of corona cases across the country is nearing 60,000 mark. Today, the Union Health Ministry has come up with a revised policy for discharge of COVID-19 patients. In this revised policy, what the Health Ministry has said is that all the very mild and mild cases can be discharged from the COVID care center after 10 days of onset of symptoms, and if they don't have fever for 3 consecutive days. So all these very mild and mild patients can be discharged even without testing from the COVID care center. So this is for the very mild and mild category. If we could check the moderate category, what the revised policy is saying is that all the patients who have been admitted to the dedicated COVID health centers can be discharged if they don't show any symptoms, if they don't have any fever for 3 days, and also after 10 days of onset of symptoms, they can be discharged from the dedicated COVID health centers. And also they need not be tested before getting discharged. But only in the moderate case where the patient needs oxygen support, only in that particular case, the patient can be discharged only after that particular symptom, that particular issue is clinically resolved. That is, only after that particular patient, if he can breathe properly, if there is no breathing issues, then the person can be discharged after 10 days of onset of symptoms. Even in that case, the person need not be tested before getting discharged. Only in the severe cases where the patients are admitted to the dedicated COVID hospitals, the patients can be discharged only after the patient is clinically recovered, and also after getting tested, after RT-PCR test is done and that particular result is negative. Earlier, if we could check the policy, was that all the 3 category of people have to be tested. At least there have to be 2 consecutive tests where the patient is turned negative. Only after that the patient can be discharged. But now with this revised guideline, for the first 2 categories, that is for the mild and also for the moderate, they need not be tested before discharge. Even in the severe category, only 1 test is needed before getting discharged.
All right. Thanks so much, Arvind, for joining us with those details. Well, we can also now go across to Dr. Romil Tikku, Associate Director of Internal Medicine at Max Healthcare. Thank you, Doctor, for joining us. What would you say about this change in policy regarding the discharge of COVID patients?
Well, they're going by the clinical symptoms. For mild cases, if you don't have fever for 3 days, you don't have breathlessness, and you're otherwise fine, you're off antipyretics medicines which reduce the fever, it does make sense, because for 10 days, it's after 10 days of developing symptoms, most of them would have recovered. And for cases where you need oxygen, they're going by the oxygen requirement, the clinical picture, whether you need oxygen. And moderate cases, if you're on oxygen for 3 days, if you don't need oxygen and it's been more than 10 days and you're otherwise fine, so they might be discharged. But severe cases, I think they're planning to check and look at the x-rays and do the test. It does clinically make sense. But again, we have to go through the literature. I think going by the studies that most of the patients, even if they have positivity after 10, 14 days, they are non-infective usually, and they don't transmit the infection, and they have actually
recovered. Fact, I wanted to ask you that, Dr. Tikku, is there any risk of that? Because you've had cases in which people have been discharged and then they come back, they get the infection once again, and that is a cause of worry. And whether if we're releasing patients who have a moderate case and we're not testing them before releasing them, is there any risk of them spreading the disease?
Well, there might be a very minimal risk, but what we have seen is nobody's come back with the active disease. Maybe some of them have been positive, that's a very few percentage, but they are not transmitting probably the disease, because that's what has been seen all over the world till now. Even if they are positive after a negative test 2 weeks post the discharge, they are not transmitting the disease. These are the remnants of the dead virus. So based on those findings, those clinical studies which have been done all over the world, I think the new guidelines are based on that even after you recovered symptomatically and otherwise clinically you are better, you will not transmit the disease to others. assuming that it is positive, but most of them actually clear it within 10, 14 days. And yeah, a minimal risk might still remain there. So, but I think they've gone by the studies and the clinical picture, which is coming up in all over the world in all these patients, that given 10, 14 days of treatment, and after you had no fever for 3 days, you've been off medication, your oxygen levels are fine, you have no symptoms, very unlikely that you're positive and you'll transmit the infection to others. It does make sense to that extent.
Right, and Dr. Tikku, with the number of cases in the country now, nearing 60,000, and we're told that we may see the peak further on, and we may see an increase of the coronavirus cases every day. Around 3,000 are being added. So this also, in a sense, makes practical sense given the burden on our hospitals, on our healthcare workers at this point.
Yeah, definitely, Gagi. As you rightly said, we have to live with it now, and we can't overburden our healthcare system. See, we having increase in the numbers, and now that the lockdown restrictions have also been eased out, the numbers are expected to rise, and we might have a surge, and we'll have to be prepared for it. Those people who really need hospitalization, who are really sick, are on oxygen, have respiratory distress, they should be in the hospital. And based on that, I think these guidelines have been changed. And for mild symptoms, if they can manage at home with people keeping track of their clinical condition, I think it's definitely makes sense. And,
all right, and just finally, Doctor, this is, if you could just compare with what we're seeing the world over and what kind of practices, because I do know in a lot of countries you're told to just stay at home unless you have breathing issues or you have more severe symptoms. Many countries are actually choosing not to burden hospitals and healthcare workers, doctors and nurses at this time, and asking for those. And in India, we know many people have very mild symptoms of the disease.
Well, absolutely. You should be at home if you have mild symptoms. You can't burden your healthcare system. But you should have a room to yourself. You should have a washroom, and somebody has to keep track of you. You have to be in touch with the authorities. Some doctor has to take an update every day. You should have a caregiver who takes care of you and also manages things at home. So if that happens, I think mild cases can be definitely managed at home. You don't have to burden the healthcare system. Everyone doesn't need hospitalization, as I said. So hospitalization should be for moderate to severe cases. As it is, there are not too many mortalities. There are not many ICU admissions. Not everyone needs ventilation. So in that case, mild cases can be managed at home. I think we'll have to live with it and formulate strategy according to the way it sort of evolves in the next few days. And the guidelines have to be changed every now and then. And it does make sense now. We don't have to burden the healthcare system. Mild cases, stay at home, but be in touch. If at any point you develop chest pain, breathlessness, or any other severe symptom, then you get in touch with the authorities, and then you might need hospitalization. But as long as you are fine at home, can be managed. I don't think they'll need any other help.